I've just chaired a meeting of the Government's Emergency Committee, including ministers from Scotland, Wales and Northern Ireland, and it's clear that coronavirus COVID-19 continues and will continue to spread across the world and our country over the next few months. We've done what can be done to contain this disease, and this has brought us valuable time, but it's now a global pandemic, and the number of cases will rise sharply. Indeed, the true number of cases is higher, perhaps much higher than the number of cases we have so far confirmed with tests. And I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous and it's going to spread further. And I must level with you, level with the British public. More families, many more families, are going to lose loved ones before their time. And the Chief Scientific Advisor will set out the best information we have on that in a moment. But as we've said over the last few weeks, we have a clear plan that we are now working through. And we're now getting on to the next phase in that plan, because this is now not just an attempt to contain the disease as far as possible, but to delay its spread and thereby minimise the suffering. If we delay the peak even by a few weeks, then our NHS will be in a stronger state as the weather improves and fewer people suffer from normal respiratory diseases, more beds are available, and we'll have more time for medical research. We can also act to stretch the peak of the disease over a longer period so that our society is better able to cope. The Chief Medical Officer will set out our lines of defence. We have to deploy these at the right time to maximise their effect.